down and told me, hey, we suspect that there's a tumor behind your eye. We think that is cancer. It made me a lot more aware of the time that I had left and time that I might be wasting. And I didn't want to miss opportunities just because, we all say, oh, when I get older, I'll do this. And I didn't know if there would be a when I get older. I was just starting my undergrad. I was in my first quarter at UCLA. And I was really excited to just get started with college and kind of work towards my dream of eventually being a doctor. I started to notice that I was having times where I couldn't really see off to the side, like I was losing my peripheral vision. I couldn't see when I was trying to shave. I had weird lapses where I would be losing balance, or like I fell down the stairs, which for me never happened. And even though I was on my phone that time, it was abnormal for me to ever lose my balance. So I had stuff like that where I just kept getting injured, and then I was losing a lot of weight, which I kind of just attributed to the stress of starting a new program, and I didn't think much of it because there's always that freshman 15, and I had lost 15 pounds in a matter of 2 months, which was really abnormal for me. I don't think I actually connected the dots of the symptoms were related until quite a bit later. I mentioned the vision changes to my partner and my family at the time, and I got a lot of stress responses back, and I guess that's what made me take it a lot more seriously, because I just thought, well, it's finals, it's 3 a.m., of course my vision's going to be going. I didn't realize it was as serious as it was, and luckily they asked me to go in and get it checked. I went in. I was going in just for vision changes, and at that point they checked into my eyes. They did a dilated eye exam, and they found that my retina was detached, and they saw a little bit of a shadow of something. They didn't really know was a tumor yet at that point. So then started the whirlwind of exams, and so the next couple weeks was just a series of labs and CT, MRI, every imaging modality you can imagine, and then rushing me to a referral at USC because they had an ocular melanoma specialist there. I was there with my mom, and I think for me, it was almost reassuring because I knew something was wrong, but I didn't really know what. And that was kind of the moment that it made sense. And for my mom, I think it was a lot harder. I mean, I can't really speak for her, but it was definitely more of a shock. And I think she spent time trying to comfort me. And for me, I wasn't really scared yet because I didn't really know what was coming. I was very lucky to have my family there to help and set up all the appointments, but it was really every single day for a few weeks that there was some kind of appointment, some specialist that I was seeing, some kind of imaging, and they all have contrast and they're taking blood, and all of these things kind of make you feel awful on top of the fact that you're already trying to deal with the diagnosis. So it's all kind of scary. A lot of those imaging modalities I had never had before because I'm young. I haven't gone through any screening. I was 18 at the time, and so all of it was brand new to me, and all of it was a little overwhelming. But for me, it was really important for me to stay in school and to have something that I was actively working towards and feeling like I was making a difference and making forward progress, because a lot of cancer, past your initial treatments and diagnosis and all that, it's a big waiting game. And I think that dichotomy from going to being rushed in for original treatment and all your diagnostics to then now we just have to wait 3 months and see what happens. That's a really hard transition to deal with if you don't have something else going on in your life, if you don't have something that you're working towards, because then you're just sitting around anxious and wondering, is the cancer growing? Did it handle it? Am I going to have to go back in and start this all over again? So that part of it was really scary, and it helped a lot for me to stay in school. For the original diagnosis, we did brachytherapy. So that involved them putting a gold plaque on my eye. It was kind of on this inside part of my eye here. So it was not super visible, but you could see a little bit of a gold shimmer on my eye when they had it on. They left that for 4 days and then removed it. They have to have you awake for the procedure somewhat. You're in a twilight so that you can respond to commands and you can look around because it's important for you to be able to move your own eye while they're doing the procedure. So those are a little scary, but you're given meds to kind of help calm you down a little bit. And then after that, it was just a lot of imaging for the retina and making sure that it was indeed shrinking. We had a 3-month follow-up, which is the first time that you know whether or not the cancer's shrinking or continuing to grow or anything. And luckily that appointment went very, very well, and we found that the tumor amazingly had shrunk down to nothing. It was just scar tissue at 3 months, which is not something my oncologist had ever seen. Um, so that was really exciting, and it was a good sign. I was just so excited that my body had kicked cancer's ass. And, um, it's scary to not know what's coming next and how much it's going to affect all of your future plans. And I knew even then that I wanted to be a doctor, and I didn't want that getting in the way. And, me and my oncologist had a lot of discussions about what that might look like for me when deciding on the treatment plan, because you can do the brachytherapy, or you can actually have the eye removed. And I was really concerned about keeping my eye, both for like future impressions, because everyone notices if you have a fake eye. But I also wanted at least a little bit of my vision and a little bit of my depth perception, because I wasn't sure if I would go into a surgical specialty when I went to med school, or just in general be a little bit more hands-on. I didn't know about radiation oncology before I went through treatment. I knew about oncology. Obviously, I'd had a best friend that died of brain cancer when I was in first grade, and then I've had a lot of family and friends that have been afflicted with cancer. So it's something that was very personal to me and that I knew I wanted to go into from a really young age. Once I finished my master's, I went on to get accepted to med school at Midwestern University in Arizona. So that's where I spent the last 4 years of my journey, and I just graduated this year. The fear of recurrence was always kind of present, but it changed my life in a better way than I anticipated. It made me a lot more aware of the time that I had left and time that I might be wasting. And I didn't want to miss opportunities just because, we all say, oh, when I get older, I'll do this. And I didn't know if there would be a when I get older. So it encouraged me to start traveling a lot earlier. I did my first study abroad trip back in 2017, like a year after I was diagnosed. And they finally were like, hey, you're going to have to do your surveillance every 3 months. But as long as you come back after that, then you can go to England, you can go enjoy your life. So that was my first time being abroad by myself. And I really, really loved it. And so ever since then, I've taken a lot of chances to try to travel like once a year. I've gone to Costa Rica, to Bali, to Japan. And I absolutely love it. I think the fear of reoccurrence forced me to do all the things that I would have been putting off, and to do all the things that I'm scared of. And it forced me to really embrace my life in a way that I'm actually really grateful for. April of this year was when I found out that the cancer had metastasized to my liver. Previous to that, I had been just not really feeling myself. I knew something was a little off. I was more fatigued than usual. My labs were a little abnormal, but nothing that threw up any alarms for any of my doctors. I just kind of had this gnawing sense that there was something wrong, and I couldn't really explain it, and the labs didn't show it. And so I went in to get follow-up imaging like I always have, every 6 months. And they found a very, 2 small lesions on the liver originally, like a year ago, I think from this point in April. And they just kind of brushed it off. Like, these are usually benign. We'll keep an eye on it. But nothing really happened. So we did imaging again in 6 months. Had still grown incredibly slow at a rate that, again, didn't throw up any flags. They still thought it was probably benign. But I was starting to get a lot more concerned. When we originally found the lesions on MRI by a year prior to April, or a little more than that, at that point, I had gone to my oncologist and said, hey, I'm really concerned that there's more to this. I really feel like we need to do more imaging. We need to look into this. And I got a lot of pushback. And from that oncologist, I was told, well, you're 8 years out. You're basically in the clear. And specifically the kind of mutation that I have, which we found on the biopsy, it's a late metastasizing marker. So it's not going to metastasize in the first 5 years in most cases, unless you find it really late. And so I went back to my primary care and I said, hey, I didn't feel like I had a good relationship with this doctor. I don't feel like I was listened to. I need a different oncologist. And that new oncologist took it seriously, did more imaging, did the biopsy. And she was advocating for me so well, like calling everyone personally from the office while I'm sitting in front of her. She did a phenomenal job. And she got me in incredibly quick. So I'm glad that I trust myself, and I would definitely tell anyone that's going through this, if something is not right, you need to advocate for yourself. Your doctors need to know, because even if they're an amazing doctor, it might not hit their red flags, and no one knows your body the way that you know your own body. At this point, they declared it as a metastatic disease. They finally said, yes, it has grown enough. There are enough lesions there that it is growing in what's considered a miliary pattern. And they decided to do the liver biopsy. So the liver biopsy then was done in April, and that's how we confirmed that it was metastatic melanoma, not some benign condition. And at that point, I found out when I was in Japan. I wanted to go enjoy my trip before we came back to the whirlwind of exams. I think when I saw the biopsy result when we were in Japan, I just immediately broke down. I wasn't ready for what was next, and I knew what that was like because of the first time. So I think that getting the metastatic diagnosis was way worse than the original diagnosis, because you know what's coming, you know what to expect and how much you have to go through. And especially now, having spent 6 months working in oncology clinics as part of my med school curriculum, I walked so many patients through the same kind of journey, and you know every step of the way, every medication that needs to come, how scary those procedures are, and you talk to them about all the side effects. And so I think it was really personal, and I had much deeper understanding the second time around. And I was definitely not ready for it at all. But I think that I had much more confidence in handling all of the appointments and knowing who to call, how to deal with insurance, because I've worked with insurance myself. Now I've seen the clinic side of things. I've got a lot of people in my network that advocate for me and reach out to whoever I need. Like my community has been so amazing to me. So I definitely was a little less scared from that aspect, because I knew I'd be taken care of by the people around me. I was a lot more supported by friends and family than I was the first time. And I think a lot more people kind of knew what was going on, and I chose to be more open about it this time because I didn't want to go through it alone. The first time was pretty isolating, and I didn't really share it because I didn't want people to see me differently or think that my cancer was somehow an excuse for anything going on with my school or with my job or anything like that. I wanted them to just see me first, not the cancer patient. So I wanted to be able to stand in success in my own right and whatever I did. And this time I think I already had the chance to prove myself. I already got into the specialty in my dream, and I had all these people that already trust me, respected me, and wanted to help. And it was just really relieving to be in a very different place than it was the first time. So I got the results of the biopsy. I got established here in Florida. And originally I was looking at doing something a lot more targeted, like histotripsy or embolization. And the more scans that we did, the more we realized there's probably more tumors there, and that probably wasn't the best first line approach. So now I've already had my first Hepzato treatment, which is a isolated liver perfusion, so isolated liver chemotherapy. And it requires an ICU admission afterwards because they have to monitor your blood pressure and make sure that you're stable, because they have to run all of your blood through this outside ECMO machine. So they kind of reroute your entire system and bypass your heart and lungs in order to do the procedure. So it's very scary, especially being a medical professional. I know all the ins and outs of what can go wrong with that. But the first one went very well, and I recovered within a few days. I've also gone through fertility preservation to make sure that I could still have kids later on, even though I have chemo in my system. So being a very young patient, I'm now 27. I still care a lot about being able to have kids, and it's not something that's come up for me yet. So that was something that was very important for me to consider, and really pushed with my team to get that taken care of before I started treatment. So that was a lot of hormone therapy for 2 weeks, and then an extraction procedure. And the Hepzato and the extraction procedure were only about 3 days apart. So it was a bit of a rough week, to say the least. But I was still able to start residency. About a week later, they just pushed back my start date a little bit. So I have another Hepzato treatment coming up, which hopefully will be my last for now. And then I've got some immunotherapy as well. We're doing like a combined dual immunotherapy. Residency has been going great. I'm lucky to start off on kind of a more chill outpatient rotation. So not people that are like high acuity or really sick, just kind of a geriatric population that I get to connect and laugh with and just help them manage chronic conditions. And that's been really rewarding to get to spend some time there while I'm still recovering and kind of handling all my appointments. It gives me a little bit more time to do what I need to do with my insurance and medical stuff while still getting to feel like I'm making a difference in people's lives. So that's exciting. I guess if I had to look back and talk to 18-year-old me with that original diagnosis, I would tell her to trust the process and to not give up all the things that she loves in her life. Take the risks, go do the things that scare you. I kind of learned that over a few years, but I think I could have taken advantage of that right away because all of those things that scare you are also some of the most healing experiences that you'll ever have. And they give you so much hope and so much life while you're dealing with something that is really just overwhelming and life-changing. So, I think I would just remind her that it's okay to share that with people and they're not going to judge you for it, and to lean on the people close to you because I'm not sure that I did that enough the first time, and I've done it a lot this time, and it's really helped. I guess the thing that is scariest with this particular diagnosis that I want people to know is that the numbers aren't everything. When you see a research study and it shows a mortality rate that is incredibly high and a low life expectancy, you really need to look beyond those numbers. And really, your treatment, especially if you have metastatic disease, it's to buy you time. It's to get you the next 10 years so that someone else comes out with the next treatment, the next one gets approved, and then you keep fighting. Because I don't think that those research studies that show life expectancy are telling the entire picture. Look beyond the research. Don't let the numbers scare you. I think that there's a lot more hope out there than what we see on just those studies. I think that this diagnosis has helped a lot when it comes to caring for patients. Especially because when I was first diagnosed, I had a physician, she's my ocular oncologist, Dr. Berry, who did a great job at taking care of my family as well. Not just me, but really noticing how nervous they were and how helpless they were feeling and making sure to include them in the treatment plan and kind of give them little tasks to do and just really help calm their nerves as well as my own. So I think going forward, when I think of my own career, I think of physicians like that took a lot of their own time to comfort the patient and the family and make people really feel comfortable, because a cancer diagnosis, with all of the treatments and diagnosis that comes with it, has so many steps that can be overwhelming and scary. And I think people just taking the time to humanize that and really explain what's coming next and what to expect and allow people to have a space to have emotions even within those appointments is incredibly healing and important. And anytime that I can do that for my patients, I want to. I love being able to connect with them, and cancer patients are some of the most incredible, resilient people that you'll ever meet, and surprisingly positive given their situation. So I love connecting with them, and I think it makes my career choice a lot more rewarding.